Hey guys, a common question that I get is, do I use ice or do I use heat? And so whenever you're injured, what do you do? And so I'll give you a little bit of a clue how you know the difference. So when you're dealing with an acute injury, especially when there's swelling and inflammation, whether that be in your spine or wherever else, that ice is going to be way better than heat because it's going to constrict your blood vessels and minimize the intense layers of inflammation. Now, some level of inflammation is normal, so you don't necessarily need to ice everything. But if it's extreme inflammation, if you can't move, ice really helps the pain relief side of things because it reduces the swelling. Now, if you have acute inflammation and you add heat to that, it's going to swell more and it's going to hurt more and it's going to be less stable. So, that is not a time to be using heat when you have inflammation, when you have an acute injury, when it's something deeper, like in your lower back, for example. When you should use heat is going to be with muscle tightness. So, heat, not so much on an acute injury, chronic tightness and things like that, you can absolutely use heat on. And that's where a hot water, hot bath, any other form of that, or Epsom salt bath is another great way to get some tight muscles to release because of the magnesium that's in the Epsom salt, the magnesium sulfate there. And then the sulfur helps with the detox, so it's kind of a detox bath as well. But that'll help to relax and loosen up those muscles because of the heat, which increases circulation. So generally speaking, increased circulation is going to be great, but when you have an acute injury, you don't want to hyper increase what's already hyper circulated. And so that's the time for ice. And if you're unsure about a situation, whether it is just a muscle or whether you have a deeper situation going on that you need to ice, just ask and we'll help you out.